Healthcare reform was needed to allow millions to afford preventative care. Photo: Joe Redl, Getty Images. The United States needed to reform healthcare because the cost was so high. Medical bankruptcies affected up to 2 million people. Rising healthcare costs threatened to consume the entire federal budget. It made the cost of preventive care unaffordable. That sent many low-income people to the emergency room, raising costs even higher. High costs made the U.S. healthcare system cost twice as much per person compared to any other developed country. As a result, healthcare contributed $3.2 trillion, or 17.8%, to gross domestic product. That's the highest percentage in the developed world. There are 3 reasons as to why costs are so high. 1. Most of the cost comes from treating people over the first 10 days and last 10 days of their life. A lot of progress has been made in terms of medical procedures that can save premature babies and extend the life expectancy of the elderly. But these innovative procedures are very expensive. Many other countries place a limit on who can receive such level of care. If the chances of a procedure being successful is low, then it is often not given. In the United States, such care is given even if the prognosis is poor. The second reason for high healthcare costs is the rise of malpractice lawsuits. Because of this, doctors often overtest, ordering $1,000 MRIs and $1,500 colonoscopies. They do this even if they don't think they're needed. It protects them from getting sued because they didn't order a particular test. The third reason is that there is less price competition in healthcare than in other industries, such as consumer electronics. It's because most people don't pay cash for healthcare. The costs are hidden. Patients only pay a set fee, copay, while the insurance company pays the rest. As a result, patients don't price shop for doctors, lab tests or procedures as they would for computers or television sets. For more details, see causes of the rising costs of healthcare. A quick review of health insurance. Since healthcare is so expensive, most people buy insurance coverage. That's why most discussions about healthcare reform is centered around making insurance more available. Insurance operates by charging a monthly fee. This is also called a premium. In return, it guarantees the insurer a payout if any medical emergencies occur. Group health insurance companies are profitable when more money is received in premiums than is paid out in claims. Most people in the U.S. receive group health insurance from their employer, who also pays part of the premium. Companies can offer health insurance as an untaxed benefit. In a way, federal tax policies subsidize the employer-provided group insurance system. Those who don't have an employer-sponsored plan must buy individual health insurance. That's expensive. In the past, companies could deny you coverage if you had a pre-existing disease or condition. As an alternative, you could affiliate yourself with a group, such as AARP or Costco. They offer lower rates because they tend to have a pool of healthy people. The federal government subsidizes healthcare for those who are over 65 through Medicare. Part of Medicare, the Part A hospital insurance program, pays for itself from payroll taxes. Medicare Part B, the supplementary medical insurance program, and Part D, prescription drug program, are not 100% covered by premium payments. Overall, Medicare payroll taxes and premiums cover only 57% of current benefits. The remaining 43% is financed from general revenues. Federal government also subsidizes healthcare for families below a certain income level through Medicaid. It is funded by federal and state general revenues. Therefore, it adds to both federal and state costs. For more, see how does health insurance work? 4 reasons to reform healthcare. Healthcare reform is needed for 4 reasons. First, healthcare costs have been skyrocketing. In 2011, the average cost for a family of 4 increased by 7.3% to $19,393. That's almost double of what it cost just 9 years before that. By 2030, it is estimated that payroll taxes will only cover 38% of Medicare costs. The rest will contribute to the federal budget deficit. Second, healthcare reform will improve the quality of care. Most Americans are surprised to find that their country has the worst healthcare in the developed world. Chronic diseases cause 70% of all U.S. deaths and affect 45% of all Americans. As the population ages, the incidence of these diseases will grow rapidly. By 2023, cancer and diabetes will increase by 50%, while heart disease will rise by 40%. At the same time, hypertension and lung disease will be up by 30% and strokes will occur 25% more often. Each year, the cost of treatment totals $1.7 trillion, representing 75% of all healthcare dollars spent. This cost can be lowered through disease prevention and wellness programs. Source: Partnership to Fight Chronic Disease. Third, healthcare reform was needed because almost 25% of Americans had little or no health insurance to cover their costs. Over 101,000 Americans died each year just because they didn't have insurance. For example, the average emergency room visit cost $1,265. If you are diagnosed with cancer, the average cost of chemotherapy was $7,000. It could even run as high as $30,000. These costs could wipe out people's savings or cause them to lose their home. Even worse, many people would have to forego treatment because they just couldn't afford it. Not only is this bad for them, it's also bad for the economy. For example, half of all bankruptcies result from high medical costs. Fourth, healthcare reform is needed to stem the economic costs of healthcare fraud.